COVID has impacted the whole hospital. It's been an interesting journey about how we all needed to work together. It's been everything from the orderlies to the catering to housekeeping and how it concerned them, and then the nurses and the doctors. So everybody has to play in a team with COVID.
The biggest single threat to the ongoing care of patients and the biggest threat to the safety of our staff is anxiety and stress.
One of the major issues that we had with this pandemic was the shortages of equipment, with the shortage of PPE. It's not really something that you think about beforehand. Can we get more scrubs? We don't want the disposable scrubs. Can we get scrubs that we're not bringing our uniforms home to contaminate our families? Then we had the issues with the laundry. Would they be able to cope with the sheer volume of uniforms that we're going to be going through? So we ended up doing quite a few things. There's a PPE committee was set up, and that was to try and alleviate some of the angst within the staff.
We've set up a COVID pod at the end of our theatre complex, so 4 of our theatres have been allocated to this. They're pre-prepared, as you can see around me, to make the environment as safe as possible for everyone in the theatres.
Effectively, the HDU became the clean ICU, and the coronary care unit was moved out to another area in the hospital. We really didn't have time to think about it. We just actioned everything. And actually, the first day when we had the cruise ship patients, it became quite overwhelming because we were bringing these patients to the hospital, and within a very quick time period we were admitting them to the ICU, putting them on ventilators, managing support for their blood pressure and seeing many varying different symptoms.
When COVID kicked in, there was obviously a massive increase in clinical waste and bins that we needed to provide. Our cleaning staff needed a bit more support, so they would bring them up every morning, make sure that they knew how to don and doff correctly, and make sure that they understood the process that we had, because where we used to have just one cleaner cleaning a room, it's now a 2-person process.
The patients were much more unwell than we appreciated. So to manage that, we really needed to make decisions on the fly. We needed to trust each other. It was expecting a lot of the staff, and they were brilliant. And it's a very Ramsay thing that we can look after each other and understand that the patient outcomes need to just override everything. In terms of the Artania patients, some of the things we did was about our appreciation and our understanding that they didn't speak good enough English so that unwell they would understand what was going on. So we actually had to modify our process to make sure there was always someone who could explain and actually give them the support that they needed.
Das Personal ist unbeschreiblich.
Es war
einfach unbeschreiblich.
Man kann es gar nicht beschreiben. Denn sowas von Menschlichkeit, von dem Ganzen, wie wir hier behandelt worden sind, so unwahrscheinlich gut. Jeder kommt und fragt und jeder. Vielen herzlichen Dank. Ja. Das ist das Erste, wenn wir nach Hause kommen, wird sein, dass wir unsere Tochter in den Arm nehmen und uns freuen, dass wir sie wieder haben, und sie wird so glücklich sein, wenn sie uns wieder hat.